it's a short talk, as you know. I mean, it's 8 minutes. So what we could do is essentially give them what happened at 4 years. So these patients I mentioned are being studied at 3 months, 6 months, then every year after that. And so, we have the 6 month, we have 3 month blinded data. We also have 6 month and then 1 year, 2 and 3 year data. We've reported on that before. What we're reporting now is what's the 4 year data look like compared to the 1, 2 and 3 year data. So there's really sustained benefit in this open label phase of the trial. Really, I think we were looking at 51% improvement in these UPDRS-3 score at 1 year, and it stayed at 48 and 48 at years 2 and 3, and now it's still sitting at 41%, even 4 years out. Now, what we have to do is look at the number of patients that are at each time point, because people get to those different time points at different times. So we have a slightly smaller number of patients at year 4. I think, we have 120 at year 4, and we had 146 at year 3. So we're short by about 26 patients, but those patients will come in. Very few have dropped out. So we're waiting really for the rest of them to come in for their 4 year assessment, and then we'll look at that again and try to compare the same numbers of patients. So again, 41% improvement yet. And even in spite of the fact that this is a progressive degenerative disease, the patients are expected to get worse at a certain amount every year. We're still seeing pretty markedly sustained benefit in these patients out that long. Well, I think what they can say, and again, in this phase, it's open label, right? But what they can say is that we see at least this degree of benefit in people that are out 4 years. And we also looked at other things. There's a number of things that you can look at. The things we're reporting, for example, are that they had a sustained reduction in medication. We had about a 30% reduction in medication. In the US studies where this study was done, we tend to be less aggressive, I think, in reducing meds. In the European studies, you'll see probably more of a reduction in medication. But in this particular group of patients, we saw about a 30% reduction. And they went up by maybe about 230 milligrams of medication from 6 months to 4 years, which isn't much when you think about this population every year. Generally speaking, you're going to see people probably with disease progression get worse by 2.4 points or more. The other thing we do present as well is a quality of life scores, because what's really important, we can measure quantitatively, clinically, I guess. How do they look? But what really counts is what do they think? How much better are they? And bottom line is, if you look at the quality of life scores, 5 of the 8 quality of life scores, even at 4 years, still stayed better than what they were at screening. So that's pretty significant. And then ask the patients, well, how many do you think that you're actually better? What do you think? That's called a global, I'm looking at these slides as we're talking. It's called a global impression of change. And really, even at 4 years, over 85% of patients said that they were better. Subjective improvement. And the clinicians who assessed them, that was closer to 90%. It was over 90% of clinicians said these people are still better. And within that, there's a range, right? So one thing we need to look at, I think, is the range, and for patients who did much better, was there something different about them? Because this is going to be a mean we're looking at. Everything's going to be around this 41%. Some people are on the downside, some people on the upside. What's the difference? The other part that we have to look at, we haven't delved into this yet, is remember, this is multiple sources, right? So people are adding contacts over time. And we saw that really over the first year or so. I think they added, I think there are probably 41% of patients had more than one contact. So now we have to go back and look at over this period of time, 1, 2, 3, 4 years. Are the stimulation parameters changing? Are they adding contacts or taking contacts away? And how does that affect the individual motor signs, but also the overall effect? So we're trying to understand better, what's the utility of multiple source currents? And by adding these separate contacts, how much are we really adding to the benefit of the patient? And that data has been collected. It just hasn't been looked at in detail yet. So that's the other thing I think that's important. And that will tell us, if you look at where the contacts are, that will tell us, are there certain locations that might be better for one symptom or another? Are there certain locations in the STM that are really better than other locations? And I think that data will also be coming out of the study. So there's a number of things we can look at. It's a wealth of data. A lot of things can be mined out of that data pool.